Now over to you, Lindsey.
Here root yourselves beside me. I am the tree planted by the river, which will not be moved. I, the rock, I, the river, I, the tree, I am yours. Your passages have been paid. Lift up your faces, you have a piercing need, for this bright morning dawned for you. History, despite its wrenching pain, cannot be unlived, and if faced with courage, need not be lived again. Lift up your eyes upon the day breaking for you. Give birth again to the dream. Women, children, men, folks, take it into the palms of your hands. Mold it into the shape of your most private need. Sculpt it into the image of your most public self. Lift up your hearts. Each new hour holds new chances for new beginnings. Do not be wedded forever to fear, yoked eternally to brutishness. The horizon leans forward, offering you space to place new steps of change. Here, on the pulse of this fine day, you may have the courage to look up and out upon me, the rock, the river, the tree, your country. Good morning. That is an excerpt from one of my favorite poems, On the Pulse of Morning by Dr. Maya Angelou, delivered January 20th, 1993 at the inaugurational celebration. I felt that this poem was timely and really captured what it is that we're going to be speaking about today as we delve into preparing for the upcoming election and the aftermath. No matter what your party affiliation, no matter how you feel in this moment, I believe that you are feeling something and that it is important that you are not feeling that alone. And that is why I've been so blessed to bring together a wonderful panel today to delve into this topic. Joining us on the virtual couch is Margaret Brown. Margaret is the Vice President of Healthcare Services at Premera. We also have Talisa Tali-Lavery. Talisa is the author of Confessions of Your Token Black Colleague, as well as the founder and managing director of Yum Yum Morale Consulting. We also have Victor Liu. Victor is the Practice Innovation Director of Asian Counseling and Referral Services. Good morning to all of you. Welcome.
Good morning. Thanks, Lindsey.
Victor, I'll start with you this morning. You have an interesting opportunity and lens into the community really on a street level and really getting to speak to people every day who are going about their daily lives, trying to navigate this moment. What, in your opinion, Victor, are the main concerns that you are hearing from individuals as they prepare for the election and whatever the outcome may be?
Yeah, thank you so much, Lindsey, for that question. And good morning, everyone. So again, my name is Victor Liu. For this work context, I use he, him, his pronouns. I'm really glad to be here with all the panelists and all of you. So for that question, I would say that as we know that we're living in a very unusual time with the state of the country, with the global pandemic, I think it just adds so much stress and different other components and elements to everyone, and not just the individuals that I have contacts with, but the populations that I mainly work with, that are Asian Americans, immigrants and refugees, and also the LGBTQ plus community members. I would say that, and as I think about how we're preparing for this election with the global pandemic, I kind of want to link it back to the pandemic. At the initial stage of it, the current administration has called it the Chinese flu, or the Kung flu that he said. And that itself has actually created so much racism against the Asian community. And the other thing that I can think of, the very recent incident when the Proud Boys hashtags was being used, it was interesting how the LGBTQ community fight back in the sense that starting to put all these interesting gays individuals showing every section of the rainbow about the Pride Boys hashtag. The reason I reference this two incident about the Chinese flu and the Proud Boys hashtag, it actually not only just instilled racism, it also instilled fear in our community. Because I'm actually thinking that for the people that I work with or interact with, we are living in this time that for somebody who is a person of color, Black, Asian, brown, gay, we are the target people who are going to be attacked because of the issue. And public health issue really is, racism really is a public health issue. That's what I'm trying to say here. But so our community members probably are living in a state of fear. But on the other hand, I also think that if we are talking about the immigrant community specifically, we're a very, very resilient community. And sometimes we are misunderstood that we are quiet individuals that are passive. And I think that this is a time that I think we are even more cohesive and coming together. I was watching at the voting election counts for the county recently. In the last election, I believe the count was around 19,000 plus at this time. When I look at it this morning, it's over 190,000. So
Wow.
it tells us a story that we are ready, regardless of the outcome, we are ready. I just think that we just need to really, regardless of our race, gender, ethnicity, and what we stand for, I just think that we should be vocal and vote and pave the ways for ourselves. And I said this last time that oftentimes BIPOC individuals, we may not be at the stakeholders meetings to have a voice. If we don't have a seat, we don't have a table, we make our own seats, we bring our own table.
Yes, yes. Show's over. There's the
Yeah.
lesson for the day. All right, everybody, see you. Have a great coffee. Absolutely. I love that. If we don't have a seat at the table, bring your own table, bring your own chair. Echoes of many great activists there. Margaret, you've also been talking a lot about this need within our community to address the public health outcry that we are seeing right now, and that especially in your position at Premera, you're really noticing that there has been a large uptick in mental health cases, the use of mental health care and access to. What, in your opinion, is that outcry? What is contributing to that in this moment?
Yeah, so Lindsey, I think Victor hit on it spot on, that even prior to this global pandemic, we at Premera have had a focus on mental health and specifically focused on access and navigation. You layer on the social injustices happening, you layer on the pressure around the election, and it is compounding the need for access to services for everybody, but in particular for people of color who have historically had access challenges and health disparities beyond the general population. So what we've seen at Premera across the marketplace is, of course, a growing demand on behavioral health services. In this COVID world, we saw a phenomenal spike in the use of virtual care, and either through an established provider using telehealth services or purely virtual care providers. And a large percentage of that was in mental health. We looked at our prescription claims and the use of anti-anxiety medications, the use of antidepressants, the use of sleeping medications have increased significantly during this period. And it all makes sense when you think about what's happening in the media, what's happening to us as individuals, that we are seeing this increasing demand, and really a responsibility for us to help ourselves, our families, our loved ones, but our community in being able to access this care. So we've at Premera, and I know across the marketplace, have increased access to virtual mental health services and behavioral health services. So we added 2 virtual providers with mental health services for Premera members, and also expanded our virtual health services to substance use providers who can support both opioid and alcohol use disorders virtually, which is, phenomenal when you think about how people can now access these services.
Yes, absolutely. And I hope that a little bit of the stigma that we still have in our country around accessing mental health services, that perhaps being at home, feeling safe, is allowing more people to get the help that we all need. I don't want to say they need, we all need. Talisa, you in your book talk a lot about the additional mental health impact of existing as a BIPOC individual, as an LGBTQIA, as a person with diverse abilities in workplaces. What do you say to the leader out there who's going, well, I've had challenges in my life and I'm just getting on with it. Why can't everybody do that?
I think that the leader is going to have to take the time to be okay with being wrong. And
yes, that's a very un-American idea, to be okay with being wrong. What does that mean? Tell me more about this.
We're telling you that you're wrong. And I'm sure if you're paying attention, there's alarms being sounded that you are thinking incorrectly and that there are these biases and microaggressions and things happening. So it first starts with just being willing to admit that maybe I'm wrong and being curious about what are these people even talking about? And if you're curious about what people are talking about, that should start you down the road to doing research, to actually trying to figure out what someone means by the extra mental traumas that we may be dealing with. I think that I know for Black people in particular, and people that, disabled or what have you, we become very resourceful, we become very strong, we present very strong. And so I can see how it can be kind of conflicting. On one hand, we're saying, take note of what we're dealing with. And on the other hand, you're like, well, they look like they're fairly strong. Yeah, I just think that these leaders need to be cognizant of it. They need to read books such as mine or the countless books that are out there, get to know minorities, get with groups such as GSBA and get the resources to understand what different people are experiencing. Anybody that is in a marginalized group, their whole life experience is very much different from a white man or a white woman. It's just, there are differences. And I think that when you drop your biases and your judgment, I think a lot of times it's like, you're not going to get this special treatment. We're not going to give you a handout. And that's not what we're asking for. And I think that the more that you start to understand what it is that we're dealing with, the more you'll realize that we don't need you to give us a handout. We don't need you to make it necessarily easy for us, but we need you to be cognizant of what's going on, because there's so many little pieces and nuances that work against us. And as a leader, if you're not aware, it's happening right under your nose and you're just focused on the money, the ROI, the money. And I was telling somebody recently that this is ethical, because you're getting to know there's a level of empathy I want you to tap into, but it's also ROI. It also ties back to the money. Companies spend $8 billion a year on diversity, equity, and inclusion training, but $64 billion a year on discrimination cases. So it would be worth it for you to take this time to listen.
Yes. And Margaret, I think also Premera is sort of seeing that research that Talisa is naming, that there is also a lot of data to back up this idea that the lost hours that go to untreated mental health conditions is actually draining the workforce. Can you speak more about that?
Yeah, no, absolutely. There's plenty of data to show that, particularly for those who have chronic conditions and untreated behavioral health conditions, there's if you want to focus on the ROI, there's significant savings in improving the mental health of those patients, in addition to physical health. And so that is a critical piece of the work we're looking at, to say physical health is absolutely important, but we have to layer on mental health. We have to do the screenings. We have to improve access. And in particular, how we address that, knowing that there are the disparities for health disparities for people of color. And you're right to be able to say, oh, how can I look at this differently to address upfront the needs that may be very different amongst different populations of people. And so we're absolutely taking that lens. And I do think that there is general movement in the marketplace to have that approach as well. But you're right, there's so, you know, you got to look at the person side of it, but knowing that there are financial motivators across the world, it's just the world we live in. All of us need to take a very human view in addition to the financial view, that dig into the numbers, because that value is also there in the long term when you think about the use of medical services that could be prevented, and improved clinical outcomes when you layer on the mental health focus onto the physical health.
Absolutely. You know, this is coming to mind. Victor, you speak a lot about, as a community member, as somebody who is preparing for the election, preparing for the holiday season that we're about to come into, that often we tend to think or fall into thinking, what difference does my voice have? Or what does it matter if I actually show up and vote, or show up to the town halls, et cetera, et cetera. But you said before that actually political activity adds to one's behavioral health. Can you share a little bit more about that?
Yeah, thank you, Lindsay, for the question. And just listening to both panelists, I just have an equity moment that I want to reflect on before I answer that question. That the panelists and you, Lindsay, we are all BIPOC individuals. I just think that is such a powerful moment that we are doing this together. And I really appreciate your thoughts, Margaret, about what we need to do to address disparities for behavioral health and substance use disorder issues. That's something that I do, and it's very, very close to my heart. But Lindsay, what I'm saying is that there is a research that's done by Robert Johnson Foundation that specifically indicates that when someone is civilly engaged, whether it's through voting, volunteer, or community participation, it actually helps them with their mental health and substance use disorder services issues. The reason for that is because I can give some concrete example. Let's say I have mental illness, which I may or may not, I don't know. So let's say I have mental illness, and then there is an issue that is going to affect my Medicaid access. The legislator is going to make a cut on it. And I was able to participate in a legislative forum, testified, and the outcome of that, perhaps it's not just because of my voice, but I have the support from my community members to participate in advocacy event, and then that helps to save the budget. And as an individual, I just think that as one person, we cannot change the world, but collectively, we can definitely do that. And that to me is a journey of a client with behavioral health issue through empowerment, focusing on mind, body, and spirits to assist them with their pathway. And it just creates more positive energy. And in general, when a person is also more civilly engaged, they also find a sense, we also find a sense of community. We find our tribes that support us. And through that, it really assists us to have better coping mechanism. But I would also say that I have been developing a habit to listen to NPR every day before I sleep. And I'm not sure whether that's good for my mental health. But then I also think that we need to be very cautious to be thinking about, yes, we want to also find that space and a time that we want to find a space and a time at every day if possible to just kind of detach away from these political issues. Civic engagement is critical. I just cannot stress enough about if we have the ability to vote, we definitely should vote. And I just think that through that process, it really enables individuals to really stable with the empowerment. And one thing that I think sometimes when we mobilize community members to participate in advocacy actions or even register to vote, we oftentimes as leaders neglect to report back the outcome of the advocacy or legislative forum event. And I think mobilizing people is wonderful, but it's also important to share what happened after you went to the legislative forum and when you speak to the legislators. And because when we know the outcomes, then people feel more empowered. That is the linkage that I'm trying to say here. And I will put the link of the RWJ research on there.
Thank you for that. You know, because what you're saying there, Talisa, I would love to hear from you in terms of there is good data to support that often the Black community feels as though they are disenfranchised, and I'm saying that wrong, not that they feel as though they are disenfranchised and it's not true, but feel as though their voice in the election is not important. How, in your opinion, in writing your book, in doing your consulting, how are you encouraging people to use their voice in whatever political forum works for them?
Oh boy, I'm being bold in the approach. I'm being really bold and vocal in that approach, which is very different from me. I've always been a very diplomatic person, open to, you know, towing that fine line. I've even heard some people still saying, you know, I'm not going to tell you who to vote for, but I'm going to tell you to exercise your right. And I'm just at a point where this is urgent. This is not, you know, 1990. Times have changed. I'm going to tell you exactly who to vote for. And I'm going to tell you to do it quickly and urgently. And so I think that for me, all I can do is just be extremely vocal about the urgency of this and how dangerous it could potentially be. And I'm not trying to be an alarmist. I just think that people need to understand the seriousness. I think people need to understand the small margin that it was as far as how Trump, you know, took office. I think people need to realize that, you know, we thought in 2016 that it was unheard of, or it was a joke, or, you know, we slept on it. And as a result, we've paid for it. And another 4 years, I don't know, you know, as optimistic as I want to be and like to be, I don't know. And so I just say to people, this is just not an opportunity to be politically correct when you're talking to people about going out and voting. This is the time to sound the alarm and to, you know, pull everybody in, because I feel like, you know, I'll simply say, if you are voting for Trump, you're voting against me. You know, and if you want to know more about that, then you need to look into that. So I just do it with an urgency. Try to give as much education as possible. I try to talk to people about their plan, like, what is your voting plan? Do you want to discuss that? You know, is there some way I can help you? Do we need to walk through things together? I've been very open about that. A friend of mine yesterday talked about us on election night, as far as being supportive, just letting people know that we're planning to come together online and kind of support each other as we watch and wait. So yeah, it's just something that I'm talking about every day, being vocal about every day, and trying to understand, and just hoping and praying that we'll be okay.
I love that, your election plan. Margaret, you've shared a little bit about the role of being both a leader in a very large, well-recognized organization, as well as trying to navigate different opinions, different political views, different cultural backgrounds, and, you know, lived experiences, different phenomenologies. How are you, or not, how are you not advocating for using one's voice while also allowing that your team members may have varying opinions?
Yeah, so it's definitely a tricky line to walk. I love, Tally, your comment about how direct you're being with who to vote for. And in my personal life, it's completely different than in my professional, of course. In the professional setting, what I've done recently, and it actually started with COVID, it amplified with, the murder of George Floyd and all of the social unrest. And now as we're approaching the election, it's amplified in how I message. But I will be very transparent that what I do is take themes that are politicized with a specific perspective and talk about kindness, talk about love for all, talk about accepting and including people of color, people of different diversity groups, and use really that core concept that people can't argue. No matter what your political view is, you cannot tell me that kindness shouldn't win. You cannot tell me that love is not okay, right? I mean, it is that tricky line because I am fully aware that there are different political perspectives and views and how people will vote on my team alone, let alone the entire company. So it starts with vote, do something, exercise your right. If you're not voting, you're not even doing your responsibility as a citizen. And beyond that, carrying through concepts of kindness, love, and inclusion into how I message to my team. I think people know what that means, but without me outright saying you should vote, you can't vote for Trump, you must vote for Biden. That is the message, that is the clear undertone of how I communicate with my team.
Yeah. Yeah. On that, and this is for any of you and all of you, actually, we wake up and somebody's potentially going to feel like the election didn't go my way. And you're at work or you're working with your clients, how do you prepare for creating spaces that does invite inclusion on the day after, that allows for somebody may not have gotten their way? How do you as a leader create and foster that space?
Well, Lindsey, I can jump in first. What I would say is, first and foremost, creating space. I think the way that you're asking it, I think as leaders, we absolutely need to create the space. I have spent a tremendous amount of time trying to create a safe place that people don't always have to agree. So we've had very controversial conversations throughout this year on various topics that I have a very specific personal opinion on, that I am absolutely aware that people on the team don't agree with. But creating an environment where people don't feel personally attacked and have a safe place to voice their concerns is what I've been striving for. Now, the post-election will put the real test on that in terms of how strong that safe environment is, because it hasn't been through that type of test, I don't think. Even the epidemic, even everything that we've been going through, I think is the election results are going to create completely different feelings than I think even all of those events throughout the year.
Yeah. Well, Margaret, you said, that it was initially quite challenging for you to lean into that vulnerability. Can you say a little bit more about that for the other vice president of a large organization who's sitting out there going, I can't create spaces?
Right. Yeah. It has been probably over the last year and accelerated over the last 9 months for obvious reasons. I am a person that if people describe what is Margaret like in the workplace, I get things done, I'm result oriented, get to business. and have recognized even recently, after 20 years of being in this industry and being a leader, that I still have a lot on my personal journey. So I started this journey around vulnerability and truly started to expose myself as a person, my emotions, my challenges, what I struggle with, the answers I don't have, and have been very transparent, even accelerating the transparency over the last year. And I don't think it's too late for any leader, wherever they are in their career, to really think about how you infuse vulnerability into the workplace and infuse love into the workplace, which there's no way even 2 years ago that I was in that space the way I am today. And so it's a risk. Was scary, but I believe that based on the engagement, the feedback that I've had with my team, that it has resulted in a different emotional support system that is very different for me, but also different for those around me. And it was scary, and it was a risk. There are people probably that still feel uncomfortable about it. They don't want to talk about those things at work. And I would say the overwhelming majority do, but there are certainly those that don't want to engage, and that's not forced. They don't have to engage. But I think the overwhelming feedback has been infusing vulnerability, infusing love, and showing that type of leadership is very different and touches people, particularly during the election, during COVID, during the injustice that's happening. People need that even more now than they ever have. And so it's definitely been a learning journey for me.
Yeah. I mean, two things that stand out for me. One is that I'm not going to feel bad about all the heart emojis I sent you in my most recent email. They keep going
Love
with that.
it.
And two, I think we fall into this psychological trap of thinking because we're not talking about something, that we're also not expressing that anger, that frustration, that anxiety. And that in workplaces, we think that the absence of discussion means that it's not showing up in the way we treat other people, the way we critique other people's work, the way we microaggress other people. So actually having the conversations means that it comes out as opposed to gets passive aggressively forced into other ways of exacting our opinions. Talisa and Victor, I'd love to hear from you that same question. What can leaders be doing now to prepare for after the election?
Great. I may, I'll respond first, if that's all right. So thank you, Margaret, for going first, because it inspired many new thoughts in me. So I would say that let's say we wake up and then the election results did not go in the way that we desire. I completely agree with Margaret that it's so critical to mix space, whether it's a workspace or personal space. And then we have been talking about ROI earlier. And then for those of you who are not familiar, the term is return of investment. I'm a clinician. I do clinical work, so ROI is release of information. That's why I explain it. But I was just thinking that we are living in a capitalist society, that we are just driven by matrix outcomes values, putting performance measures first versus humans first. And I just think that it's so critical to be thinking that to do the work that we want to do, to make that space, we basically, I think, need to treat employees like humans first and not be treating employees like machines. And creating a space is challenging. With the BLM movements, the challenging against gay people, LGBTQ plus individuals and immigrants and refugees. In the organization that I work at right now, and even my other roles as a city commission with the LGBTQ commission, I have to be very cautious because I work for a nonprofit, which is a 501c3. So I have to have a nonpartisan position. And then as a commissioner, I also have to maintain that. But I just think that there is ways to do it. I completely agree with what Margaret said about creating a space that is infused with love and kindness. And I just don't think that we do enough of that. So definitely have a personal space. Different people process the aftermath differently. So I think we also need to create different accessible platform for people. Some people may not want to talk about it at all. And then there are going to be some people that, yes, I would like to go to this community meeting to have a debrief about it. So I think we need to take figure out different ways of providing the space and channels of communication, and then allow people the time to process and say what they want to say. Oftentimes as leaders, I think that we don't listen enough. It's our job to give instructions and things like that, but I just think that it's also a critical value that we truly listen. And yes, I agree, Margaret, about the risk. I in fact think that as leaders and people in senior leadership position, we have to be bold, be a little bit rebellious, and take calculated risks, and embrace healthy conflict. I think we're, especially speaking for myself as an Asian individuals, in our community, we don't like conflict. We're very quiet people. We don't like uncomfortable situation. But I just think that it's okay to disagree and about a topic and agree to disagree, and we may not completely agree at all. And healthy conflicts, I think, are good because it prevents misunderstanding. It prevents any unintended hidden agenda. And I just think that we just need to be bold, rebellious, listen, create a space, and truly embrace healthy conflicts. I'm not trying to get you to fight here, but you know what I mean? But it's a healthy conflict is good.
Yeah, thank you. Talisa, your thoughts?
It's no secret that I'm pro diversity, equity, and inclusion. And one party is not, even to the fact that Trump, in fact, tried to demolish my whole industry. So, yeah, I don't have to be quite partisan in that area. But if I was giving advice to a leader that did have to kind of be very careful about things, I would just say be quiet for a while. Recognize that November 4th, potentially, even November 4th, no matter what happens, even if we're waiting to the results, what have you, I think of it as that I will be waking up in a whole new world. And that's been happening a lot for us this year. Certain times we wake up, what is this today? But I approach it as if you're entering a whole new world. People are going to be dealing with new rules and new circumstances and new challenges and new conversations and just new things that they are not even prepared for. I've learned that, we're sitting here on this webinar and we're trying to talk things through and we're trying to look for resources and prepare. Most people are just taking it day by day. And so a lot of them will stumble their way into this new world that, we're trying to mentally prepare for. And I think that we all have to be open to being quiet and listening and learning what that next move is and how we should pivot as leaders or pivot as business owners. I'm not going to walk into it all knowing and just knowing exactly what I'm going to do. I have some ideas, I have some, strategies written down, but I'm open to who knows what's going to happen and how that's going to happen. And I think that we all have to be willing to just be quiet and to have some grace during that time as well. Because we don't know what people are dealing with. So I think that we all need to be gracious and open to communication as it starts to happen. And like Victor said, be open to that healthy conflict because it's probably gonna happen. But if you can, for a while, I've always said this, if you can for a while, say less, be quiet, then I would advise you to do that for a while. But while you're doing that, make sure you're listening, make sure you're taking notes, and make sure you're prepared to say something. As leaders, we have to talk. So, but for a while, just absorb and look around and determine what is this new world that we're going to be stepping into.
Wow. I mean, I'm just, my own mind as a leader at LTHJ Global is having a little bit of a, reset moment in thinking about, we do not yet have tools that there's no book that already is mapping out, this is what to do in preparation for the next day after a major election, while living through a pandemic, while living through a huge social unrest, while, right? And this idea that I have to go in knowing and trusting that again and again and again, we are making it up as we go along and having to solve for it and create new solutions. You know, I think it does ask a lot of our leaders to truly be innovative, to truly reimagine what is possible to reach our human potential. I'd like to know, because sometimes I center the show on myself and get my needs met. I'd like to know, what advice can you give me as a leader out of your toolbox? What are you each doing right now as leaders to take care of yourself? Because you will also be waking up the day after the election as a human in this society. What are you doing? What are your tips and tricks that you can give me and my family that I might be able to take with me?
So I can jump in first, Lindsay. First, it's such a great question because for me personally, I take care of my family. I take care of my aging mother. I have my team, and it is so easy to forget to take care about take care of yourself. So I think that's such an important piece that we need to get the message out there. I am a person that likes loud music. I do tend to exercise and work out, but one of the things that I've done lately, and this is now going on 6 months, which I don't know, at my age, I never thought I would change so much from a leadership and even a personal perspective, but I started yoga. And I used to laugh and say meditation, yoga, that's not me. My mind's usually racing. I'm a list person. I've got loud music going on. But about 20 to 30 minutes every morning, I take my Apple Watch off, I put my phones away, and I truly take that time to myself to do yoga. And so it's been 6 months now. I'm a lot more flexible too, but it has been something that I would have laughed at. I think I did maternity yoga 15 years ago when I was pregnant, but outside of that, never really bought into that. And it has been remarkable for me to create that time for myself that I otherwise wouldn't. I'm usually coffee and go, and to actually breathe, clear your mind, and take care of yourself. So that's one thing that I've really protected my time and created that space for myself.
Wow.
Yeah. Thank you, Margaret, for sharing. I just love that we have so much things in common. We definitely have to meet in person. Yeah.
Yeah, I love it.
You should show us some moves about
this. You all know
yes,
that, right? Yeah.
yes. I was going to, Margaret, you should show us some flexible yoga moves. No, just kidding. But it's the reason I joke about we have so much, a few things in common since this conversation is that I'm very religious about yoga. And Lindsay, I'm not sure whether you want to do that. I have this routine now that I'm doing even more religiously, that besides my terrible habit of listening to NPR while I'm brushing my teeth, then I do my 15 to 30 minutes yoga because I don't have a lot of time. And that is the time and space that I have for myself. And I promise myself that when I'm doing that yoga, I don't think about anything at all that is work related or my personal life. I just want to have that focus time. And it really helps me to initiate my day with calmness. And then once I'm done, I take my shower and then I go on with my very busy life. But I think that definitely helps. And then beyond that, for people who know me well, is that I like cardio a lot. So I'm obsessed with fitness. And no matter how tired I am every day, I try to do, people think it's crazy, but I try to do 1 hour to 3 hours of cardio exercise every day. And I just think that to me personally, I think with a fit mind, good physical health, it helps me with my emotional health. And then one thing that I agree about, leaders need to show vulnerability because we are humans, and vulnerability to me is a strength. However, though, I'm also being very mindful of it, depending on the meetings I'm in and the target audience, because I think it can have a negative domino impact. Because if I show that I'm completely stressed that day, it can have a negative vibe that rubs on people. I know I'm derailing slightly now, but anyway, yoga and cardio, that's my recommendation.
No, that's a really great point, Victor, because there's a difference, I think, I don't think I feel very strongly about between vulnerability and not taking care of one's own behavioral health, and then as a leader coming and making your behavioral health needs now your employee's job to solve. And so I think you're saying both, that part of why we attend to our health and mindfulness and well-being practice is so that we can model making sure that we are getting care for ourselves, so that we are not putting that strain, that unhealthy expression of stress as the burden of our team members. Does that feel right?
Absolutely. That's what I was trying to say, that yes, we have emotions and all that. I just think that it has to be the right setting to do that. It also has to be a safe space that allows that trust, because I'm just very cautious and cognizant about my personal vibe when I'm in certain meetings, because I know that it can affect the people that I work with. And if people, oh my God, this is the director that is leading this process and is completely falling apart, then I think that we need to figure out, not that we cannot show our emotion, I just think that we need to figure out a balance and the right space. And hopefully we have another person that we can talk to and vent, because we all need that space. And hopefully it's not just your spouses or partners.
Yeah. I think there's something so powerful in a leader being able to say, I just don't have it today, and I need to go take care of me. And so I am going to allow someone else to lead this meeting or lead this project so that I can model taking care of my health the way I encourage each of my team members to take care of their health. Absolutely. Talisa, what are you doing?
Yeah, so keeping in this theme of preparing to walk into the unknown, I have a very light schedule the week after election day. And I would advise any leader, and so that kind of lessens the anxiety leading up to it. And I would advise any leader not to like do new meetings or anything that's strenuous or hard or challenging or that takes a lot of focus if you can, and to also probably do the same for those that you're leading or partnering with. So for me, it's just been intentional that I do very minimal the week after, and that I'm almost on autopilot. And again, like I said, I feel like that will be helpful during that week, and it gives me that space to be quiet and to listen and to absorb and to plan. And it just keeps me calm as we lead up to the event. And I think too that as leaders, what I would hope that you would take from this is that you don't feel this pressure to move and act so quickly. And there will be some that will, and there will be some that need to. There are people that while I'm listening, I want to hear certain people that are in that position. And I guess you need to decide where you are. But for me, I tend to like to, in anything that I do, I want to assess the situation where I am. And because I have this strong feeling that we're going to be in a completely different world, I just want to have a very thin schedule that week where I am just listening and talking to people that I can trust, and, brainstorming with people that I can trust. So,
Yes. Today, I want to open up the panel to our community, whether you are on the call or joining us on Facebook or LinkedIn. If you have a question specifically for Margaret, Talisa, or Victor, please go ahead and share that now, so that we can get that in front of them and get your questions answered. While we're waiting for that, I'd love to know what your thoughts are on there's someone on the call today that is feeling as though they really don't know where to turn. They're a leader who is potentially not feeling as though they have the support networks to make that call to say, I don't have it, I actually need a break. Or there's a team member that isn't in a culture right now where they can make that call. What's your advice to them?
So Lindsey, I can go first. As it relates to the mental health component of it, I think I'm talking really clinically right now, but using all the available assets, I think as from a Premera perspective, we offer EAP counseling at no cost, or for usually 8 visits a year. But really, I think the first step has to be, well, first step is acknowledgement, which is great, but understanding where there are tools that are available. I mentioned the virtual care assets that we have. From a Premera perspective, we offer Talkspace, which is text-based therapy, and we also offer Doctor on Demand behavioral health, which is face-to-face or telephonic. And I've used both, and I'm pretty open about it, that from a mental health perspective, not being afraid to reach out and use the assets that are available, whether it be your doctor or nurse or counselor, physically through a brick and mortar telemedicine, or through understanding what benefits you have access to, making that first step to try to understand and access the resources available. And that's a very clinical answer in terms of, what should leaders do? But I think acknowledging that you as a leader need to take care of yourself and address your needs without creating that burden on your team. I love how you connected that, Lindsey. And knowing where your resources are to help tap into what's available to you, I think is important for everyone to know.
Thank you. And
Yeah.
here's one final question from our community. What communication strategies do you use in your teams during times of crisis? And that's from Vito Valera. What communication strategies do you use in your teams during times of crisis?
So I can tell you, sorry, if Victor or Tally, you want to go. I can tell you that what I've done in the last 6-9 months now, I'm losing track already. I use email, and while I used to use email, we use daily email to communicate. I started sending a weekly email to my team, addressing proactively whatever topic of that week. Typically it started with COVID, but transformed pretty quickly. And it was a way to build that safe space I was talking about. And quite frankly, it's therapeutic for me to be able to put my thoughts into the universe written. First commits me to something, but also takes weight off of my shoulders. So it's sort of selfish for me to be doing that. The other thing that I've done is we use Teams at Premera, and we have hosted a series of open forums. So virtual team meetings with no topic, no agenda, come if you can, let's share what's on our mind. And those meetings have been well received as well. The emails are probably easier for people because I've had individual responses that people might not feel comfortable sharing in a team forum, but those are the two primary communication channels that I've been leveraging quite often during this time of crisis.
Yeah.
I will share very quickly too. I agree with what Margaret has said. One thing that I think what I have been being very mindful is that before we start any meeting in this global pandemic and very stressful time with the upcoming election, it's not starting a meeting with business agenda. Like truly ask people, how was your day? How? Because I think we neglect to do that. We sometimes go straight to, okay, this is the agenda. This is what we're going to do today. It goes back to what I said earlier on, is to treat people like humans and not machines, with dignity and respect and compassion, by being authentic and asking them how are they doing in a good way, and allow them to say whatever they want and have the ability to process it. And the other thing that I would say that in my way of communication, maybe it hasn't come out in this meeting yet, I like to use humor. I like to be funny, and because I just think that then that way it also creates this energy. You already set the tone in the meetings that you want people to be upbeat about it, create a non-intimidating space for people. And I just think that humor is critical to do that. And if at all possible, I would say that we are all very zoom out this day with the number of Zoom meetings and team meetings. That is trying to find ways to make it fun. So a recent example that I can think of, like, it's not Halloween, yeah, but Halloween is coming. So it wasn't mandatory, but when I had a meetings, we decided that people who want to dress up. And then we just did this early Halloween thing. And it created this fun thing. And I was glad that my colleagues, friends, and peers joined me in that process. And I'm sure that we will continue to do things like that infuse that fun. And the thing that if I don't mention, I will definitely regret, is food. If at all possible, even in a virtual meetings, eat together, cook together, share a meal together, because food is a universal culture and it feeds more than a body, but it nurtures the soul.
Yes. Oh, I love that. Yes. Talisa, final thoughts?
I think that in all that you were doing, just be able to check in, not only mentally how you're doing, but check your morals. Lindsey, you mentioned that there were people that potentially said, I don't have the resources, I don't have the space, I don't have, the flexibility to be able to speak or what have you. I think that you need to ask yourself if that's really true, and can you afford to even say that based on your mental capacity and your morals and just your overall goals as far as being a leader and what your mission is and what you want to stand for. I've had a very recent conversation with myself about what I need to do versus what I feel needs to happen. And so I think a lot of times we need to just really stop and ask ourselves, is that really all you can do? Is that really your only limitation? Or, is there some room there? So I would leave people with that.
Yes. Yeah. Is that the story you're telling yourself, right? Margaret, Talisa, Victor, thank you so much for this really important conversation. As always, I've learned some things that I'm going to take into my own life. And I hope for all of those who joined us from home or from wherever you are today, that you have some great insights that you can add into your toolbox. And just know that we will be here, GSBA, LTHJ Global, we're here to support you. You can send us an email anytime. You can contact us online if you need a pep talk or just to feel seen and heard. Good night, everybody.
Thank you for having me.